Hello and welcome to Pregnancy Info. Today we will discuss the painful menstrual periods, causes and its treatment. Painful menstrual periods may be more common with irregular periods or heavy bleeding, but certain medical conditions include endometriosis and pelvic inflammatory disease can also cause them. Dysmenorrhea. Menstruations occur when the uterus sheds its lining once a month. Some pain, cramping, and discomfort during menstrual periods is normal. Excessive pain that causes you to miss work or school is not. Painful menstruation is also called dysmenorrhea. There are two types of dysmenorrhea, primary and secondary. Primary dysmenorrhea occurs in people who experience pain before and during menstruation. If you have had normal periods that become painful later in life, it may be a secondary dysmenorrhea. A condition affecting the uterus or other pelvic organs such as endometriosis or uterine fibroids can cause this. What are the causes? It's not always possible to identify the cause of painful menstruation period. Some people are just at a high risk of having painful periods. This risk includes being under age 20, having a family history of painful periods, smoking, having heavy bleeding with period, having irregular periods, never having had a baby, reaching puberty up before age 11. A hormone called prostaglandin triggers muscle contractions in your uterus that expel the lining. These contractions can cause pain and inflammation. The level of prostaglandin rises right before menstrual begin. Painful menstrual period can also be the result of an underlying medical condition such as premenstrual syndrome or PMS. PMS is a common condition that's caused by hormonal changes in the body occurring 1 to 2 weeks before menstruation begins. Symptoms typically go away after bleeding begins. Endometriosis. This is a painful medical condition in which cells from the lining of the uterus grow in other parts of the body, usually on the fallopian tubes, ovaries, or tissues lining the pelvis. Fibroids in the uterus. Fibroids are non-cancerous tumors that can put pressure on the uterus or cause abdominal menstruation and pain, though they often don't cause symptoms. Pelvic inflammatory disease or PID. PID is an infection of the uterus, fallopian tubes or ovaries, often caused by sexually transmitted bacteria that cause inflammation of the reproductive organs and pain. Adenomyosis. This is a rare condition in which the uterine lining grows into the muscular wall of the uterus, causing inflammation, pressure, and pain. It can also cause longer or heavier periods. Cervical stenosis. Cervical stenosis is a rare condition in which the cervix is so small or narrow that it slows menstrual flow, causing an increase of pressure inside the uterus that cause pain. Home treatment. At home treatments can be helpful in relieving painful menstrual periods. Types of things to try at home include using a heating pad on your pelvic area or back, massaging your abdomen, taking a warm bath, doing regular physical exercise, eating light nutritious meals, practicing relaxation techniques or yoga, taking anti-inflammatory medications such as ibuprofen several days before you expect your periods, taking vitamins and supplements such as vitamin B6, B1, E, omega-3 fatty acid, calcium, magnesium, raising your leg or lying with your knees bent, reducing your intake of salt, alcohol, caffeine, and sugar to prevent bloating. When to contact a doctor. If menstrual pain is interfering with your ability to perform basic tasks each month, it may be time to talk to your gynecologist. Talk to your doctor about your symptoms, and if you experience any of the following, then you should discuss it with your doctor. Containing pain after IUD placement, at least 3 painful menstrual periods, passing blood clots, cramping accompanied by diarrhea and nausea, pelvic pain when not menstruation. Other symptoms can be fever, severe pelvic pain, sudden pain especially if you may be pregnant, foul-smelling vaginal discharge. Diagnosis. When trying to find out that the underlying cause of painful menstruation is, your doctor will likely take your medical history and perform a physical exam. This will include a pelvic exam to check any abnormalities in your reproductive system and to look for signs of infections. If your doctor thinks an underlying disorder is causing you symptoms, then they may perform testing like an ultrasound, CT scan, or MRI. Medical treatment. If at home treatment doesn't relieve your menstrual pain, medical treatment options exist. Treatment will depend on the severity and underlying cause of your pain. If PID or sexually transmitted infections are causing you pain, your doctor will prescribe antibiotics to clear the infection. Your doctor may also prescribe medications that include non-steroid anti-inflammatory drugs or NSAIDs. You can find these drugs over the counter or get prescription strength NSAIDs from your doctor. Other pain relievers. This includes over-the-counter options like acetaminophen, Tylenol, or stronger prescription pain medications. Antidepressants. Antidepressants are sometimes prescribed to help lessen some of the mood swings associated with PMS. Your doctor may also suggest that you try hormonal birth control. Hormonal birth control is variable as a pill, patch, vaginal ring injection, implant, or IUD. Hormones prevent ovulation, which can control your menstrual cramps. Surgery can treat endometriosis or uterine fibroids. This is an option if other treatments haven't been successful. The surgery removes any endometriosis, implants, uterine fibroids, or cyst. In rare cases, a hysterectomy is an option if other treatments haven't worked and pain is severe. If you have a hysterectomy, you will no longer be able to have children. This option is usually only used if someone isn't planning or having children or is at the end of their childbearing years. Here are some postures of yoga that can also reduce the pain in your abdomen during menstruation, like lying straight and move your leg right and left. Another posture is by laying down and have a pillow or a towel under your belly. Another posture is that you can straighten up your legs and you can take the spot of wall and hold it for the count of 20 and do this exercise 5 to 10 times. This can help to prevent the cramps during menstruation. So this is all about the menstruation pain and its causes, treatment, and all about. So if you find this video useful, then like it, share it, and also subscribe our channel. Thank you.